What's good, Dr. Good? Here's palpation video number 2. This is Chef. Do I have permission to palpate?
Yes, you do.
Right on. Alright, we're going with the clavicle. Sternal end, acromial end, SC joint, AC joint, jugular notch here, and then the manubrium. Okay, go ahead, turn around. Got the acromion process up top here. Should show on the other side, but it's that flat bony ridge where the clavicle meets right there. Let's see. Go down here. Got the lateral border on the scapula. Go down the inferior angle. Lateral border, inferior angle just down here. Medial border right there. And then the spine up here. Find that bony ridge kind of going downwards there. Alright, go ahead, flip around. And then also the coracoid process right in here. Alright, moving on to the humerus here. Got the head of the humerus inserting right in there. Got the deltoid tuberosity down the arm right here. The greater tubercle right here. Lesser tubercle. Then the intertubercle groove going down through here. And then also the neck of the humerus just below the head. Alright, cool. Now we're moving on to the deltoid. You got the anterior, lateral, and then the posterior fibers over here. Anterior is going to help with shoulder flexion and internal rotation. The lateral fiber is going to help with abduction, and then the posterior fiber is going to help with shoulder extension and also external rotation. Now we got the pec major here, coming down through here and then here. You got the lower fibers here. Lower fiber is going to help with shoulder flexion, adduction, and then medial rotation. The upper fibers here are going to help with shoulder flexion, adduction, and also medial rotation. I think I messed it up. The lower fibers are going to do shoulder extension from a flex position, adduction, and medial rotation. So pretty much the same thing. You got the lat. Okay, go ahead, turn around. Latissimus dorsi on one side, going around from here all the way up and inserting just over here near the shoulder. This is going to help with shoulder extension, adduction, and medial rotation. You got the teres major coming down from here, going up to the humerus here. It's going to help with shoulder extension, adduction, and medial rotation. We got the coracobrachialis, which is on this side, kind of in here, just deep. This helps with flexion, also assists with abduction. All right, and then go ahead and lift your arm. Got the serratus anterior just in here, running this way. This is going to help with protraction, upper rotation, and extension. Then we got the pec minor. You can feel from the coracoid process just here, coming down. You got protraction, depression, downward rotation, and anterior tilt of the scapula. Moving on here, we got the subclavius. Find the clavicle just here, going down. And this is going to help with depression of the scapula. Now we're going to move on to the trapezius. Go turn around. Trapezius here, we're going to feel it. Goes up to the neck here, over the shoulders, spine of the scapula, medial borders, and also down the back here. The upper fibers of the trap are going to help elevate the scapula and do a little bit of upper rotation and also some retraction. Got middle fibers, which are their sole purpose is really just to retract the scapula. Then lower fibers that help with depression and downward rotation. Then we got the rhomboids. You got the major here, and then the minor, just superior to it. Both of these are going to help with retraction and downward rotation of the scapula. And then finally, we got the levator scapulae, running from the neck up here, which helps with, as you can see, shoulder elevation. Thank you.